Welcome to Deuk Spine Institute. It is August 1st, 2024. It's our last case of the day. This patient has two bad discs in her back, shot, L4-5, L5-S1. And we've already done her Deuk plasma rhizotomy. You're doing great. Lay still. Num num. Num num. Come on, Luis. She had the Deuk plasma rhizotomy done by Dr. Patel, shot, and she got some relief, but not the relief she wanted. And she has these two discs that we were hoping were not causing too much pain, but in the end, after doing the facet treatment, we realized they are causing a lot of pain. So here she's back after having the Deuk plasma rhizotomy for her facets. She's now having her disc repaired. Two discs repaired, I should say. So, if you have questions, feel free to ask us. This is a live stream. It is live spine surgery. It's our last case of the day. And, shot. I'm making my way down to the L5-S1. She's also had prior back surgery. AP, we've lost half of a drop of blood. Giving you some numbing medicine. You're doing great. Oh, it's perfect. Just lay still.
Take a couple slow, deep breaths from me, okay?
I got great news. Everything is going perfect for you. Just lay still.
You don't have to move your hands so much, please.
And I'm doing a nice narration. Narration. I don't know how to say it properly. You're doing great. Lay still, shot. All right. Are you comfy? Is that where you get your pain? That's what I thought. Well, when we're done, that pain's going to be gone, okay? You like that? I was just telling everybody, not about who you are, but about what experiences you're having. How we did your facets already, and that didn't take away all the pain, and now you're back to get the discs fixed. So I know this is going to work wonders for you. You can see from her x-ray, just lay still. I just need you for just a minute, okay? Don't move, AP. You're doing great. Everything's good. We're going to put you to sleep in a minute and finish your surgery. Everything's going really well. So you can see her facets have some arthritis. Yep, lateral. The needles are in perfect position. All right. How long have you had back pain for? Shot. How many years? 10 to 12 years. All right. Did you have an accident? So. All right. L5-S1 is the first disc we're fixing, and then L4-5. Okay, just don't talk too much right now. I need you to just give me a second. Let me get some information, okay? So lower back pain, how long?
12 years.
When I asked her where the pain was, she told me it was in this area. Like I said, we did her facets already. She had a good response with the medial branch block. We thought we were going to nail it with the facets, but then after we fixed her facets, the disc started hurting. She's not the first patient where that happens. Are you comfortable? Yeah. All right. How bad is that on a scale of 1 to 10? 8? It's an 8? That's the highest it went? 9? Is that where you get your pain typically? 9 out of 10? All right, that was the disc. So that good news, we're going to fix that for you. Yes. Are you better now? Is that still hurting? Shot. How bad is that? How bad is that on a scale of 1 to 10? All right, 10. Is that where you get your pain? Great news. We tested both discs, and just as we suspected, they're both hurting you. When you wake up, that pain will be gone. All right, go to sleep. Count out loud from 1 to 100. All right, so far we've lost, I don't know, probably 5 drops of blood, and that's all we're going to lose for the whole surgery. Why aren't we doing 4-5 first?
Oh, you just said.
No, I want to do 4-5 first. The days of 5-1 first are over. I've changed my philosophy. Henry, can you show our audience why there's so many different causes of back pain, and what are they, and how do we figure out what's what?
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm. Sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Okay, great. Thanks, Henry. So you could see from our video that there are 30 things that can cause back pain. And by the way, they're not equally prevalent. Prevalent means, frequent. Some of them are far more common than others. For example, the disc is by far the most common cause of back pain, followed by the facet joints. The facet joint is the second most common cause of primary back pain. So disc, then facet. In this patient, we know for sure she had facet pain, but we already treated it. And after we treated it, well, she came back and she was in agonizing pain. So guess what? It wasn't the facet. At that point, it was just the disc. And we went in and we tested them today in the surgery, and sure enough, one of them was a 9 out of 10 and the other one was a 10 out of 10. So I think she's going to have really good relief. By the way, having pain is not everything in the discogram. If you notice, I also asked the patient if that is the typical pain they get every day. That's important, because if you're creating a new kind of pain they've never had before by injecting dye, well, that's not very helpful, is it? We don't want to fix a new pain. We want to fix the old pain they have every day. So when the patient answers, yes, that's the pain I have every day, the name for that is concordant. Concordant, C-O-N-C-O-R-D-A-N-T. And that's why we ask that question while we're doing the discogram. We want to know if this is concordant pain. All right, any questions, Henry?
At this moment, no current questions. So in the meantime, let's show the audience of how is it that back pain is caused.
From a disc herniation.
From a disc herniation, correct.
Because we've already talked about the 30 causes. Now let's look at a few of those causes, and the disc being the most common of those causes. By the way, before we go, you see the pink stuff there?
Yes, we do.
That's the inflammation. That's the source of pain. That one spot right there. I still have to clean the tear. The rest of the stuff has to be cleaned out because the inflammation will never stop as long as there's a herniation stuck in the tear. And I need to clean it out. So go ahead and show our audience how that tear causes so much pain.
Copy that.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Welcome back. You can see from our video that I showed you the pink tissue. That pink tissue is the inflammation. And that's happening here in the disc. I went in and zapped it away, so that takes the pain away for the patient. But we also want to get rid of the source of inflammation, which is the herniation that's stuck inside the tear. Nobody's ever talked about this before. We are the first in the world to discover it at Deuk Spine. I am the first to discover it, along with Arias Deuk Majan, my son, who was helping me with the research. We published it about 2012, so about 12 years ago was our first publication. Luis, you started here 10 years ago, right? Just after we published that article. That's incredible. Who's making noises? Is that the patient? All right. She's a lovely lady. You're good. We're almost done. Yeah, this is the bad part. This is the part where most of the pain happens, right here on the outside of the disc. Any questions from our audience, Henry?
At this moment, no current questions.
All right. Why don't we show the audience about facet joint pain, because this patient had both.
Copy that.
1. All right, welcome back. We are finished with our first disc, the L4-5. Now I'm going to move on to the L5-S1. And you saw in this recent video that Henry showed you that facet joints can be a source of back pain as well, right, Henry?
Yes, sir.
Did we show our audience how to fix facet joint pain with the Deuk plasma rhizotomy?
I showed both.
You showed both.
Yes,
Wonderful.
I apologize. I should have.
That's quite all right.
No worries.
So you guys could see the facet joint is different than the disc. It's in the back of the disc. There's 2 facets for every disc, a left and a right. And the facets are not the most common cause of pain. The disc is. The facets account for 10% of primary back pain, major cause of back pain, and the disc is 85%. So the disc is by far the most common. But facet pain occurs in 45% of patients, 45, let's just say 50% of patients with chronic back pain. So if you have a disc problem as your primary source of back pain, you will probably 50-50 chance of having facet pain as well. So we need to be aware of that as doctors, and we're treating chronic back pain. We need to know the facet joint is probably going to be causing pain at least in 45% of patients that we treat. Shot? Is that it, Jordan? Thanks. Okay. So there's almost a 50-50 chance every patient that walks in your door with chronic back pain also has facet joint pain. Now, facet joint pain, we can cure it now with the right treatment. And the right treatment is the Deuk plasma rhizotomy. RFA doesn't cure it. RFA gives temporary relief, but it will not cure it. Spinal cord stimulator is the wrong solution. It's a horrible procedure that is very risky and does not cure pain. The best treatment is the Deuk plasma rhizotomy. I think we got to pull the guide wire back. Wait. Just pull it back a little bit. Yeah, just a little. That's enough. Shot? I see. Let me just try to advance first. Any questions?
Yes, we have a question coming from Michael on YouTube.
Shot?
Asking, can there be a bulge or prolapse of the disc without actually having an annular tear?
No. So, Michael, there can never be a bulge or prolapse of the disc without an annular tear. It's impossible. Impossible. Hold on. Let me just look at it. Shot? Yeah. Shot? Yeah. You cannot have, shot, a bulge. Shot? You cannot have a bulging disc or prolapse disc without a tear. Shot? Gotta have a tear. The annulus is the wall of the disc. She's so thin, you know. The annulus is the wall. It holds the nucleus in. The herniation is when the nucleus escapes. The nucleus can't escape unless it gets through the wall. The only way through the wall is through a tear in the wall. So the whole notion that you can have a herniation without a tear is wrong. I don't know. It seems to be something that I've heard on the internet, but it's just absolutely wrong. Okay? It's impossible. We are in 5-1 at this point, 5-1, and 5-1 was a 10 out of 10, right, guys? Very painful. The blue stuff is the nucleus pulposus, the herniation. And you see the gold color right there, that's calcium. The pink color is inflammation. So there should be no inflammation ever in your disc. There should be no blue stuff ever in your disc, which is the herniation. There should be no pink stuff, no blue stuff, no bone spurs. All that's abnormal. All of it comes about for one reason. And this is a very collapsed disc, by the way, 5-1. It's degenerated. You know, it's been this way for a while. This didn't happen overnight. This has been going on for years.
We have a question
Yeah.
coming from Izod on YouTube.
Welcome back, Azad. For some reason, you're grabbing the tines. It's just a gentle, there it is.
Izod on YouTube asks, the instrument that you use doesn't harm the nerves and spinal cord. Is that the case? And also, how is osteophyte different from a bulge/herniation, just from my understanding?
Sure. A bulge herniation is the annulus and the herniation, the nucleus. An osteophyte is bone. The herniation is not bone. The annulus is not bone. A bone spur is bone. Osteophyte is bone. Three totally different materials. The white stuff right here is the annulus. The blue stuff is the herniation. Together they make a bulge. This stuff here is bone. That's a bone spur right there. Okay. Bone is very different. Bone, when you hit it with a laser energy, it turns a gold color like that because it has calcium in it. Bone is made of made of calcium and basically minerals. All right, we're almost done. I need about 2 minutes and we'll be done. 2 minutes. 2 minutes. All right, great questions from the audience. I think we've shown all of our videos.
We've shown every single video except how to cure discogenic lower back pain. Would you like to show that?
Oh, I thought you already did that.
No, we showed the discogenic lower back pain, but we not showed how to cure it.
Yeah, that always follows, so
Okay.
just play that afterwards.
Not a problem.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
On the what?
No, on the trays for the ENT.
Oh, right.
Yeah.
Welcome back, and you can see that the laser removes the herniation with laser precision. All right, this disc is so collapsed I can't even get my grabber down there, guys. Very hard to do. So you're almost done, sweetie. You're doing great. She is just starting to wake up, and we're just about finished. I need like 2 minutes. Just this is a really stubborn area. Meanwhile, I know we have a question. Come on over here,
Yes.
Nikki or Jordan, and help Dr. B.
We have 2 questions. This first one coming from Michael once more on YouTube,
Hi, Michael.
asking, thank you for clarifying, Dr. Deuk. Does the annular tear occur vertically or horizontally across the disc?
Both. The annular tear is both vertical and horizontal. Both.
And then lastly, from Izod once more on YouTube, asking, the same procedure/instruments are used for both osteophyte and herniation, or different?
The same. You see, the osteophytes are right here on the side. and I'm using the laser for both. All right, I think that might be everything. Let me just see. I don't see any more herniation. All right, I think we're done.
Sitting on, please.
Yeah, we're done. We're done.
Sitting on, please. Thank you.
Great job. Yeah, the laser is used for both the osteophyte and the herniation. That's a great question. The laser can fix everything in there. There's nothing the laser can't clean out. It's a very versatile tool. As a matter of fact, this laser is used to remove prostate tumors, kidney stones, calcified prostates. I mean, lots of different procedures. It's a laser not just for spine, but it's a laser also for OBGYN procedures. I mean, you name it. It's a medical laser, and it's the safest and best medical laser you can use. Holmium YAG. Holmium YAG. HOLMIUM YAG, YAG. There's cheaper lasers, but they're more dangerous. Like a CO2 laser, very dangerous. There's yttrium YAG. There's yttrium lasers. There's a variety of different kinds of lasers, but this is the best. And we only use the best for Deuk spine. Okay, can you guys see this here? 7mm incision.
Yes, we can.
And this lady's had 12 years of back pain. Thank you, everybody. Good work. Any other questions? 7?
No current questions.
All right, Henry, let's end our stream, and we'll be back next week.
Copy
Thanks,
that.
everybody, for joining us today from Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. And we had a really good day. Helped a lot of people this week. Thank you.